Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
Now it's my honor to introduce Dr. Rosemary Laird with ClinCloud. And as I was saying before you got here, Joe Steckler, our president and founder, has always talked so highly about you. I mean, Joe is the guy who created the Brevard Alzheimer's Foundation. And when he retired from that, then he created us literally 15 years ago because he said there's more work to be done on behalf of seniors. And the work that you guys are doing at ClinCloud, I believe, is going to revolutionize everything for generations to come. So with that, I'm so honored to welcome Dr. Rosemary Laird.
What I am excited to talk about today, so I am a geriatrician who came to Brevard County in 2002 to help the Health First system start some aging programs. There weren't any until that time. And a group of lawyers on the board at Health First, Cape Canaveral, are there legal folks in the room? We have them to thank for getting the aging program started at Health First, the board of directors at that time. So another group of really prescient people knowing that we should start then to be able to have services now. So that was the beginning of the Health First, what is now the Aging Services Program, with my good friend and partner, Dr. Viera, still sort of steering the way with that program and all the others that have grown up with us in that time frame. And one of the pieces missing in Brevard County, we weren't missing a lot, but one of the pieces missing was clinical research, clinical trials. We had a pioneer, Dr. Kirk on Merritt Island, who was doing it for a long time, and their group is still working today. But beyond that, the vast majority of the county was not serviced by any of the clinical trial companies. And at some point, maybe about 15 years or so ago, the world realized that you can't get advances in pharmaceutical development quickly enough if you're only testing people who can show up at Shands Hospital or at, Mass General in Boston, at the big academic centers. So we started having centers out in the community and having them become certified and licensed and regulated by the FDA. So it's still a very regulated and quality-driven activity, but it brings clinical research to where we all live. The majority of us get our healthcare in our community, not at places like the big tertiary medical centers. And so that's what they realized, and that started much of the progress. And Alzheimer's disease has been fortunate to be amongst the diseases that have had some progress. And so today we're all together here at a really important time. And we have ClinCloud here now for the last 4 or 5 years, located in Viera at the corner of Spyglass and Murrell. And it's really allowed us to bring some opportunities to the community that we wouldn't have had. And I'm really excited about it because that's the jumping off point for what I want to tell you today. Some of you may be thinking, well, a clinical trial, I don't know. I don't want to be a guinea pig, and I don't want to go through all of that and get poked and prodded and everything. And gosh, I don't have Alzheimer's disease or anything like it. So would there really be any need for me to know about this kind of thing? Well, suspend those thoughts, and then let's talk about what we're going to talk about, and then we'll come to that question again at the end. So before I jump too much further, show of hands, who has been in your primary care provider's office and have been asked, hey, what have you done to keep your brain healthy lately? Just show of hands. Get them up there. No. Now, one, thank you. I knew there must be someone. No. Now, that was not planned. That was not planned. But thank you. Okay. So are you serious? You're not just shy. No one has asked you about what you've done to take care of your brain health lately. Okay, see? So this is why this is a problem. I'm going to tell you why this is a problem. None of us, myself included, have been paying attention to the health of the brain as much as we should. And there is some groundbreaking understanding and research that has gone on that helps us know now that the reality of Alzheimer's disease and similar diseases like that. So you may have heard of dementia in a variety of terms, vascular, Lewy body, Parkinson's disease related dementia. All of those illnesses, there's some understanding now that they don't necessarily have to end up like what we all know of them today. And that's what we're going to touch on. But it's going to take some paying attention to our health to make that happen. So on the next slide, let's go ahead. You're probably like, gosh, she's 10 minutes in and she hasn't even gotten to her second slide. Okay, so we're going to go to the other left. Yay! Great. So I promise we're gonna get through all of this. Lots of good information. The reason I'm saying that we need to think more about our brain is because our brain has one of two things happen. Well, possibly two things happen to it. It certainly ages, right? Every part of us does, and the brain has a particular type of aging that can happen to it. And it also can get disease. And we haven't necessarily paid as much attention as we need to both the aging process of the brain and the disease process of the brain. Fortunately, much of the research that's been done to develop medications to treat these illnesses is going to help us. So listen to this. Alzheimer's disease itself is an example of a disease. So repeat after me. Aging is not the same as Alzheimer's disease. If you are in an exam room and someone tells you, don't worry, that is what should happen because you're X, fill in the blank, 72, 67, 85, 90, be polite, but realize you need to get more help. Different help, because that is no longer, in my opinion, a professionally acceptable answer, especially if you're asking the question, do I need to do something more to take care of my brain? Or if you're bringing a symptom to someone. I used to kind of just let it go, but now I am serious. Do not let anyone tell you it is only because you are X age. That's like my next campaign. And the reason I'm saying that is because we know now these are diseases. Amyloid protein is the disease maker of Alzheimer's disease. It's an abnormally folded protein that does exist in all of our bodies. Some of us, though, do not manage this protein well for a variety of reasons. Like, why does someone get arthritis and someone has a heart attack? For a variety of reasons, some of us do not manage the presence of this protein well, and it's able to accumulate. The picture you're looking at is all the nerve cells, a bunch of tissue that is supposed to be doing our thinking, one nerve talking to another sort of thing. If amyloid gets in there and messes up the transmission of one nerve talking to another, you can't think clearly. That's the disruption that happens. Now, amyloid plaque's only one part of the story. What it does, this misfolded protein, the other part of the disease of Alzheimer's disease is what you see up there labeled tau tangles. In an effort to help ourselves, our body does what it thinks is a good thing. It says, there's too much amyloid. I'm going to call tau to the rescue. Tau is a protein that on the paper looks like it'd be a good thing. It helps with repair. It brings the warriors of inflammation and cell repair to the scene. Unfortunately, it does it in too much. It has too much gusto behind it. When there's too much misfolded amyloid, you get an overdose of tau protein. In an overdose form of tau protein, what was good is now bad. And all that inflammation and irritation, you can think of it like, oh, today I actually have an example. I'm always pretending to have a scab on my hand. Today I do. It's like amyloid is a scab on your skin. Tau comes along and tries to help, but in so doing, it pulls that scab away. And what happens when you pull a scab away? It bleeds and gets angry, and it keeps the process going. That's what tau does. So those are disease states. That's not aging. That's a disease. That's why it's important not to let anyone tell you, oh, you're having this symptom. It's from aging. It may be, but you want to find out if it actually could also be from disease. You're not going to sit tight until you know whether it's from a disease or not, because there are now things we can understand about the disease of the brain that we couldn't before. Most of my career, the answer was you can't diagnose Alzheimer's disease. Has anyone heard that? Yeah. Well, now that's different. We can, and that's why you leave that room and you go find someone else if someone says that to you. What I want to move into now is this idea of, well, what would I do if I had a concern or if I had a loved one who had concerns? How would I know if something was just because I'm X age or if it's because of an illness? And one of the things I like to explain to everyone is that Alzheimer's disease is an example of an illness that has a very long and smoldering kind of start to it. It can be many, many years in the making. And so the point at which a symptom may appear is typically when we all start to get worried, right? That's when we or someone who loves us sees something and they say, well, now that needs some attention. We need to find out from someone, what this is. And that is why sometimes we end up being very worried about all of our senior moments, right? Anyone had them? I certainly have. Anyone said, oh my gosh, is that the beginning of Alzheimer's disease? I don't need a show of hands. I know, I'm very clairvoyant on this one. It's a human nature thing. So what I want to do today with this picture in mind is give you a couple of pointers about how you want to start thinking about this with regards to either yourself or someone you love. Because I do want you to leave today with a sense of, I'm not trying to panic anyone, but because no one else is talking to you about it, I do want you to leave with a sense of, well, maybe I'm in the clear. I hear nothing from that woman that makes me concerned at all. But maybe you might hear something and say, well, now that's interesting. I might need to get that looked at. Who knows? But let me give you the information. This slide is labeled a particular way that I really like. And it says it's a personal guide to Alzheimer's disease. One of the key lessons from today is that I want you to think about yourself and not your friends when you're thinking about this issue and your risk of something like Alzheimer's disease, because every one of us is very different. You see on the list some early signs, changes in short-term memory, personality or mood, and language skills. Those are 3 of the earliest signs of a change that could become a diagnosis of Alzheimer's disease. Some people, when they come to see me, have all 3. These are the early signs to keep aware of, but I want you to be aware of them with respect to, has there been a change for me in the last few years in this area? So the reason I want you to remember the personalized is because whether you can keep up with your friends at bridge or golf or at the club or at church or whatever has no bearing. Whether you are different today than you were 3 years ago has a lot of bearing on this issue. It's really hard not to compare yourself to other people. My husband and I have races now to see who's going to remember something sooner. And of course, if you lose the race, you're like, oh my God, can't believe he got that one. And that must be me now. It's my turn to get Alzheimer's disease. So try to avoid that. But the point here, I hope everyone's getting it, is this is about you and how you've changed with time. And those 3 areas are the areas that are of most importance in the early changes of this disease. So you would want to sort of keep in the back of your mind if you've sensed anything like that. So on this next slide, in addition to understanding how you would think about the illness of Alzheimer's disease for yourself or a loved one, I want to open up this discussion to make sure that we're all aware of the range of things that we now know that impact the brain and make the potential for a disease like Alzheimer's disease that much greater. Risk factors is the terminology the medical world uses. And this is where I'm so excited to make sure that we talk about this more, because there is evidence of benefit to reducing these risk factors if you have them that can really change the potential of someone's risk for Alzheimer's disease. Now, the top row are probably the big three. If you look at the data, high blood pressure and everything related to diabetes and obesity, the way our body manages that whole condition, those three things are some of the most toxic to the brain over time. We didn't know about the diabetes connection and the obesity connection until probably the last 5 years or so ago. And guess where it came out? In the research trials looking at the treatments for obesity. They figured it out. And then the scientists who work on Alzheimer's went and checked their notes, and they started comparing, and they started finding this connection. That's how clinical research helps all of us, is that back at the ranch, these scientists are putting together these different pieces of information that they glean from thousands of people in these clinical trials to help us understand how the body works. So that's been a very important advance. The next row are some that everyone wants to deny. Hearing loss. Who wants to raise your hand and say, yes, I'm having hearing loss and I'm very proudly wearing my hearing aid? Thank you. Thank you. I mean, just like me with my glasses, I tell people nowadays, just think of them as the AirPods. You know, everyone wears the AirPods. Just put it in. But the evidence is very strong on this row. Hearing loss, smoking, and obstructive sleep apnea. The evidence is very strong that while those things aren't a direct disease of the brain per se, they are impactful in a very negative way. And in general, what we're trying to do is we've got only one brain to keep healthy. Aging does change our brain. What we're trying to do is not allow other things to change it on top of what's going to happen from an aging standpoint, because you can't really do much about aging. So these are the things that are in your control. And that bottom row are the things that are out of our control. Female, our genes from our family history and our age. So those are already done deals, right? Genetically, we're already predisposed. The important thing to understand about those pieces of information is that when people pay attention, there is research that shows even women, older people, people with genetic risk for Alzheimer's disease, if they pay attention to these other risk factors, their rate of developing Alzheimer's disease is lessened. Their rate of progression of Alzheimer's disease, if they get it, is lessened. So even my patients who have family histories, we've done the blood tests, they have a high genetic likelihood of getting this illness. There is now evidence that if they pay attention to these other factors that can make the brain less healthy, even if that Alzheimer's process takes hold and starts, there's a relative benefit to their overall brain health, if that makes sense. So you're sort of protecting your brain and improving its overall health, so that you've got sort of what's the term? You've got sort of a dam to hold back the damage if the Alzheimer's were to come in. And I think that page, I don't know if we're going to print out the handouts, but that could be, I don't know if we would or not, but we can probably, Rose, especially that risk page. Yeah, I really like that. We might want to start printing that one out. Okay. And then I added this slide mostly in case, I know it's too small to see, but again, maybe this can go on the back side, because what I also like to do with this, again, these are early symptoms. And what I like to do is give you a sense of changes that you can think about that do tend to happen early, because let's face it, we would all want to know about something like this as early as possible. The reason I keep focusing on early has to do with the reality of what we now know about Alzheimer's disease. When I was in medical school many, many years ago now, it was a disease of the old people. It was as if you didn't have to think about it until somebody was 65 or 70, literally. I was training to be a geriatrician, so it was like a big deal for me, right? But my friends, everybody, my colleagues who were going into different specialties, it was like, well, they didn't have to worry about that because it's the older crowd that's going to get this illness. No. Guess what we know now about when Alzheimer's disease begins? The way this works, if you can see it, is this is when I'm, say, 40 years old. And then I'm 60, 70, 80 going that way. This is when I don't have any symptoms. This is when my first symptoms develop. So between here and here, this is the line of changes of disease happening in my brain. You guys can't see it, but 40s, 20 years before we think it could be further back. The science so far says it's at least 20 years back, that the brain starts changing, not aging. If you're going to have Alzheimer's disease, it's a disease that's setting in. Going back to what we learned about the difference between aging and disease, right? So yes, the brain is aging, but for some of us, a disease is setting in way back then. That's why, for me, I'm like, yes, your doctors should all be talking to you about your brain health. But this information is literally just becoming known, and it's starting to make its way out into the world of the medical providers. And so it's starting. We know about it at ClinCloud a lot earlier because the research is going on. And we're starting to have research that is for people who have no symptoms whatsoever. And in part, it's because of what the scientists know about this process of, despite having no symptoms, there are people who may be at risk for this to be happening. And you can't detect it in day-to-day life, but we can detect it in other ways. So that's why I keep talking about early so much, is because much of the evidence that is coming in suggests, as you probably could imagine, that if we knew someone was at risk for Alzheimer's disease or one of those illnesses, and we interrupted, or we somehow were able to slow that process or even stop it, hopefully, who's the youngest person in this room? I think it's Rachel. So I'm hoping in Rachel's lifetime, she will see that we can stop it. Then there's a lot of motivation to find out early, isn't there? Because once our brain is affected, there's less ability. And the older our brain is, just like the rest of our body, the harder it is for an older body part to improve or get better. Unfortunately, we all probably know that. It's just harder. So you want to find and fix things earlier. So that's the reason early is important. So research is all about answering unknown questions in medicine. So one unknown question is, how do we stop Alzheimer's disease? And that primarily is leading to the development of medications. But there is also an unknown question of, how do we diagnose Alzheimer's disease in its earliest stage? So there are research trials focused only on how do we diagnose. So for example, for a long time, we thought a picture of the brain was the only, we thought fluid from a spinal tap was the only way to diagnose it. I'm very happy to say we've evolved. Then we moved to a picture of the brain called a PET scan, an amyloid PET scan. Now we're moving to, you'll be happy to know, a blood test. They're close, pretty close, but not 100% through the FDA approval process of a blood test. So most likely within the next year or so, that will become much more available. A blood test that helps us know about risk for Alzheimer's disease. That's where the doctors come in, and that's where all the research still has to happen. And that's kind of why we're here today, is there are trials going on right now looking to find people who may have no symptoms or have early symptoms, but have evidence of these markers of illness that the research looks for are called biomarkers. Actually, that's not true. A biomarker is anything that we can learn about your body. So your weight, your blood pressure, how far your eyes can see, those are all biomarkers. A PET scan or a blood test is called a biomarker. So that's where you'll read about trials that have to do with biomarkers of Alzheimer's disease, and that's part of what we're doing. Because in my little picture here, that little tube there of blood, look when that is being tested, that's at the 20 years before stage. The diagnosis is still being made over here. So we're still learning, but we're trying to find people early. Now, it's a whole big, it's a whole nother conversation, because not everyone who gets told they have a blood test that says they're at risk will get full-blown Alzheimer's disease in their life.
I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.